Thank you.
Okay. What's this?
Basement membrane.
Basement membrane. Okay. 3 words that name that epithelium.
Non-keratinized, stratified
Non-keratinized,
squamous.
stratified, squamous. Give me an example of an organ where you find that.
Esophagus.
Esophagus, oral cavity,
Please.
rectum, vagina. If this is the esophagus, what's this?
Lumen.
Lumen. 2 types of non-living matrix.
Collagen and elastin.
Collagen and elastin. Now this isn't the best slide, but what we're looking at is this right here. Let me show you the next one. It's better, it says here. We're looking at the best example is that those cells right there. Cell type.
Cuboidal.
Best example is that right there. Cell
Columnar.
type. Columnar. Cell arrangement.
Simple.
Simple. Because notice what? All the nuclei are in a straight line. Now if I asked you 3 words that name that epithelium, what are those 3 words? Columnar, simple, ciliated.
Those are columnar, not cuboidal?
Those are, that one right there.
Are those micro?
They're cilia. Remember, microvilli are much smaller, they're shorter. No. Esophagus is non-keratinized stratified squamous. What is this?
Trachea.
Simple ciliated, columnar. What's its function?
To move stuff.
Function is movement. What are we moving, ladies?
Oh, the oocyte.
Fallopian tube. Okay. It's those cilia that move that down. So if this is the fallopian tube, this is the
Lumen.
lumen. Okay. Right. Okay, now we've seen some of this before. What organ is this? This guy over here gives it away. We just looked at it. What organ is this? What is that? Yeah, it's chondrocytes. It's hyaline cartilage. Okay. That's the tracheal ring. Okay, so the organ's the trachea. Okay, now I've got higher magnification. So what's the, without looking at it, without getting real close, what's the epithelium there?
Pseudostratified.
Pseudostratified, ciliated, columnar, with blood vessels. Now if we go, we're going to look at these. Okay, if we look at that cell right there, cell type,
Columnar.
cell arrangement,
Pseudostratified.
pseudostratified, because what? Notice the nuclei are what?
All over.
They're all over the place. Okay, what's this up here?
Cilia.
Cilia. What's that?
Goblet cell.
Goblet cell. What's the function of the goblet cell?
Secrete mucus.
Secrete mucus. What's the function of the mucus in this organ? Traps debris. What's the function of the pseudostratified ciliated columnar?
Movement.
It moves the mucus
Out.
out. Okay, and I've got another one here that, okay. Okay, so this is still pseudostratified ciliated columnar, same stuff. We're looking at this thing right here, cell type, squamous. Cell arrangement,
Simple.
simple. What's another name for that cell, this epithelium in this structure? Endothelium. Yeah, okay. Because that's a blood vessel. Remember, in the neck, trachea, blood vessels are everywhere. Another example of that.
On the test, if one of them's the pseudostratified, ciliated one, are we allowed?
What's that, Amanda?
On the pseudostratified one, are we allowed to abbreviate it, or do you want us to?
You can abbreviate it. You and I both know what it is, that's fine. What's this?
Adipose.
Adipose. Name that cell.
Adipocyte.
Adipocyte. Always looks like that. What's all these cells here? Lower magnification.
Adipose.
Adipose. What's this?
Capillary.
Small
Oh.
artery.
Small artery.
A little bit bigger artery. Capillary. What'd I say about adipose? There is
Lots of capillary.
lots and lots and lots of blood vessels everywhere.
So capillaries will just be smaller than
Yeah.
arteries?
Yeah. Small arteries are generally round because they got smooth muscle. We can look at this. This is lower power. What organ?
Small intestine.
What organ? Maybe I'll go up a little bit higher and look at the epithelium. What organ? What's this right here?
Basement membrane.
Basement membrane. How are the cells all oriented? At a 90-degree angle. And you have these dark dome cells or umbrella cells up here. What organ?
Bladder.
Bladder or
Ureter.
ureter. Okay. What type of epithelium? Type of epithelium? Transitional. What's the function of transitional?
Span.
Staying in
Change.
track.
Stretch. Is the uterus not transitional?
No, because it's smooth muscle.
Smooth muscle.
We looked at this at the first, it's a little bit different. This is another connective tissue. Loose or dense?
Loose.
Regular or irregular?
Irregular.
Irregular. Type of fiber is that one or that one?
Elastin.
So what's this one?
Collagen.
Or this one or this one? And all
Collagen.
those dark spots are
Fibroblasts.
fibroblasts. Okay? So, your exam is going to be what? Your practical is going to be off of these slides. These are the same slides. I'm going to ask you the same thing. Now, when you're studying, once again,